right, welcome to another episode of Medicine Mondays. Yours truly, Dr. Pierre, and the question we got this week: are COVID cases on the rise again? Part one. And number two, is this something we should be worried about? Right. So let's answer the first question: are COVID cases on the rise? The answer is yes. Now, before we go running for the hills, buying up all the Pierre, if you're a first-time listener of the show, we'll ease you in. But my long-time listeners understand and already know, right, especially if you follow Dr. Barry, that we talk about COVID being a season of two. Typically, for comparison, just so we can understand, everyone understands about flu season. They typically know, all right when it starts getting towards that winter time frame, I need to start thinking more about the flu because the flu is coming. So everyone's pretty much aware of that. What happened with COVID is that, of course, initially when it first hit us, it was all through the winter time frame. But we've noticed since COVID's arrival that it also likes the summer as well. So if you had a quiz, right, quiz $500, hey, what is a big difference between the flu and COVID? There's a lot of differences, but one of the main differences is that COVID has 2 seasons per year, whereas the flu has 1 season per year. So we're getting ready for it's the summertime. It's hot, depending on where you're at. It is hot. It's summertime. So we expect and are not shocked or surprised, especially in a healthcare setting, that COVID cases are rising again. And I think it's important to understand why they're rising again, right? Why during the summer does it happen to be that way? And more importantly, where is it rising at, right? And how are we even knowing this? So to kind of give some background, right, especially from a data perspective, y'all know that since COVID has not been deemed this significant pandemic emergency, our data for collecting our facts and figures on COVID severely has been hampered. So we typically have to do, especially when we're just thinking about COVID cases, COVID variants. I know, especially if you've been watching me for a while, you haven't heard me talk about variants for a while. When we think about these COVID variants, we don't have the luxury of being able to swab a whole bunch of people and get all these variants. No. So what we've done is we've actually changed our method for collecting our data when we're trying to figure out, okay, are COVID cases going to be an issue? So we've moved all the way to checking the water supply, wastewater supply, in fact. And you may be asking out there, why are we checking the wastewater supply? What is the importance of chasing the wastewater supply? Well, let me tell you, part of the reason why we go after the wastewater is, one, it's easier, right? It's much easier to obtain samples of wastewater than it is to go knocking on someone's door saying, hey, can I swab your nose to see if you have COVID? And by the way, if you happen to have COVID, can I check to see which type? Just trust me, it's much easier to do it that way, right? Checking the wastewater. Number two, and I think an important one, is that now we can really employ a more community level approach on how we're assessing our COVID variants and our COVID cases going to be on the rise. Because now I can take a look at specific communities and see, hey, is this community going to have much more effect on COVID? Is the community, let's say South Florida, Western Florida, or this specific neighborhood, are we going to have more cases over here versus over there, right? So from a community level perspective, it becomes a little bit easier for us to be able to kind of diagnose this rise in cases. And I think it's important when we do that is being able to act quickly. One of the things since the beginning of, since the flu, but definitely since COVID-19, our biggest advantage is being able to act quickly when we have a diagnosis or when we are recognizing an issue at hand. And because with COVID wastewater testing, not only what are we seeing a rise in the cases, number two, we can start seeing, all right, what specific variants are causing the rise in cases. And number three, we can start anticipating, hey, I'm starting to see this rise over here in this section over here. And because I'm starting to see this rise over here, guess what? We better be worried about it. So with this new, especially again, if you've been, I'm not sure how much, especially with politicking these days, I'm not sure how much COVID discussions are happening now, on your regular TV shows like they used to be all the time. But now we're seeing an increase in ER visits, which is expected because we're seeing the increase in COVID levels in the wastewater. But more importantly, we're seeing it at specific places. So this most recent summer bump in COVID cases are happening in the southern and western portions of the United States. Not to say that it's not happening, in the Northeast, and it's not to say it's not happening there, but we're just seeing a majority of our newer cases and our rise in new cases happening in the Western and the Southern area. And it's resulting in more ER visits. So a lot of people are going to the ER for symptoms and happen to be diagnosed with COVID. I tell you, I work in acute care hospitals, long-term care hospitals, rehab facilities. And one of the things I will tell you, and what the numbers will show, is that yes, we are getting this rise in cases coming to the ER. We're getting this rise in, levels in the wastewater. But guess what? The hospitalizations, and more importantly, the deaths are not rising. If you're watching this episode to see all right, is this something that, the hospitalizations and deaths are not rising. And if you go back to the beginning, one of the, selling points of when we were promoting people to get vaccinated, get boosted and whatnot, is we need to decrease the hospitalizations and the deaths. Yes, it is still possible for you to get COVID-19 if you got vaccinated or boosted. That is I'm not going to say common sense, because a lot of people who are anti-vax would try to use that as a talking point. So yes, it is okay if you get COVID-19 after getting vaccinated or after getting boosted. The goal is to make sure that the hospitalizations decrease and the deaths decrease. And thankfully, we're still seeing that hold to par. So we're loving that. Shout out to everyone who's gotten vaccinated or boosted. And we'll talk about boosting a little bit later in the show. So it's important to understand that we are getting rise in the water levels. We're getting the rise in the ER visits, but thankfully we're not seeing a significant rise in the hospitalizations and deaths. But more importantly, no one should be surprised by this, right? If you follow someone like Dr. Pierre, you understand, hey, summertime's coming around. We have more people traveling. We have more people gathering inside because it's hot. Let me tell you, I just took a trip with my wife. We went to Arizona. I'm in Florida. We went to Arizona, and I was praying to get some of this Florida heat back after coming from Arizona. That shout out to all of my listeners from Arizona, my podcast listeners from Arizona. Shout out to y'all. Y'all are, I have to commend y'all because we were there for less than a week, and I was ready to go because that heat was something different. 98 degrees at 7 o'clock in the morning. Something different. Neither here or there. So more people are gathering indoors because it's hot. More traveling occurring. And again, because of the distribution of COVID, it's kind of that recipe to say, yep, we're going to see more cases. We're going to have to deal with more cases. Now, what should we do? The most dominant variants right now of COVID cases are KP.2, KP.3. Those are under the Omicron umbrella, right? You guys are very familiar with Omicron. One of the issues with Omicron, obviously, is how transmissible it is to others. It's not as virulent as the Delta variant. Guys, if you're here, you remember what the Delta variant did to this country. So it's not as virulent, but it is as transmissible. So again, we're getting a lot of cases being spread, a lot of levels being elevated. Our wastewater, thankfully, it's not resulting in more hospitalizations. And I can tell you because, yes, I'm seeing patients in the hospital, but I'm not necessarily seeing patients in my long-term care facility. And that typically means when you have a really, really bad COVID or just respiratory disease process that kind of knocks you down. I'm very few and far between that happening. So what do we do, right? When we start seeing these cases, right? When it's the summertime or when it's going to be the wintertime, what do we do when these cases start rising? Well, we've already written this playbook. First and foremost, you got to stay up to date on your vaccines. You got to stay up to date on your boost. Looks like we have updated boosters coming in August. We'll talk about that when it comes around. So updated boosters coming in August. Yeah, you got to wash your hands. You got to sanitize. And I know people may not want to hear this. You got to start wearing your mask, especially in the high risk areas. I was traveling in an airport and airplanes, my mask was on, right? Because I do it a lot more because I want to protect people from me more than anything else, especially as a person who works in one of the high risk areas with COVID being in front, which is the hospitals. I understand that your risk of getting COVID from me is going to be likely much higher than my risk of getting COVID from you. And especially if you don't work in these high risk settings. So a lot of times I will wear my mask, one, because obviously I'm looking out for myself, but more importantly, because I understand that I pose a greater risk at giving you COVID than you likely pose a greater risk of giving me COVID just because of where I work at. We talk about firemen and they run towards the fire. Hey, if there's COVID over there, I'm running towards the COVID. I'm walking into the room, I'm talking to the patient, I'm talking to the family. It's like, I'm going in that direction. It is what it is, especially when you're a physician. And one way I knew that the COVID cases were rising, the healthcare facilities are starting to ask their employees to wear masks again. And that's always been one of the mandates from CDC standpoint, that if you started getting a rise in cases in your county area, the high risk setting places, aka hospitals, rehab facilities, their employees should start wearing masks again. Because obviously we won't blame 100% on our healthcare workers, right? The ones who don't wear masks anymore for various reasons, right? They're vaccinated, boosted, they cannot wear masks, and the rates are low. They cannot wear masks. But sometimes, again, when you're dealing with the sickest of the sickest patients, the most immunocompromised patients, I don't want there to be any shred of inkling that I may have provided my patient with the COVID. And I take care of patients who live in the facilities. So it's not like they're going outside anywhere, right? So it's not like a lot of times they don't have family members who are coming to visit them. So the likelihood of a resident of the building getting COVID and getting it from an employee who's supposed to take care of them is extremely high, right? And I don't want to do that. Right. I don't want to have to deal with that, and I don't want to have to add to that flame. So I've always worn my mask. Like, I haven't stopped wearing my mask. I actually prefer wearing the mask. I'm just different. I like wearing the mask. It doesn't bother me. I can breathe all day with, all those various excuses there. But it is one of these things where COVID used to be the topic, but I understand that. And with the job that we've done, shout out to, medicine and science and public health, with the job that we've done, we've wanted it to get to this point here. We wanted it to get to a point where the only times we're really talking about COVID is if that summertime coming up, wintertime coming up, or we got a new COVID vaccine available. That's where we want. Right? Because those who are fortunate enough to remember what it was like when COVID first came around, when mask and lockdown and people were dying left and right, those who are fortunate enough to survive that, this is what our goal was, right? Our goal was to get us to a point where it's like, oh, we're starting to see more COVID in the water again, y'all. Hey, make sure you're washing your hands, you're wearing your mask when you can, and if you haven't got boosted, go get boosted. Like, this is the point that we wanted, right? And obviously, we're not going to give any credence to our anti-vaxxers. They've lost, right? Like, you always think about an argument where you're arguing back and forth and you're like, all right, this time will tell. Time has already told. Those who've been vaccinated, those who got boosted, help get us to this point here, right? And I think everyone who got vaccinated, everyone who got boosted, everyone who wore a mask, everyone who social distanced when they can. I think everyone who did that to get us to this point where I could be like, all right, guys, we got a new variant. It looks like it's another Omicron variant. Looks like it's not as severe, but it can't spread. It's the summertime. I know you guys are going to be traveling. Make sure you get your boosters. Like, I'm thankful that we got to this point here where I can comfortably say, like, all right, yes, the new cases on the rise, but guess what? Hospitalizations haven't budged. Deaths haven't budged, because those are the two endpoints that we always want, especially deaths. We would always want it to decrease is the hospitalizations and deaths. We've done a remarkable job with that. Again, at all times, especially when I talk about COVID, I want to shout out to my public health folks, shout out to my physicians, shout out to the frontline workers, shout out to the maskers, the social distancers, shout out to everyone. And then more importantly, even those who could not do it because they were immunocompromised and they couldn't get the vaccine, but they did everything else. Shout out to you guys as well. It's obviously, sometimes it's difficult because the likelihood that you knew someone who passed away from COVID is extremely high. I'm not going to say 100% because I know someone's going to be in my comment. I don't know anyone. Okay, cool. Congratulations. But when you've been on my side, where I've probably taken care of hundreds of patients who have passed away from COVID, I understand the blessing that it is to be able to come on here and say, hey guys, we rising cases again, but guess what? We can relax. We don't have to lose any sleep. It's definitely a blessing at hand, right? So I just want to, again, just kind of touch base what we need to do again. Get vaccinated, get your boosters, right? I think August or September, we're going to get a new set of, new COVID vaccine out that can cover some of these newer variants that are rising. And remember, KP2, KP3 are the most dominant forms right now, variants in the country, affecting people all under that Omicron umbrella. Make sure you are masking, especially in these high-risk places. I know you guys are traveling. Shout out to those who got stuck on the Delta issue. Some people may still not be home at the time I'm recording this, just so you get an idea when I record this. And then wash your hands, get your hand sanitizer, right? And just be blessed, right? Be blessed and be thankful that we are here, that we survived, and we're able to report on COVID as, oh, hey, COVID season's coming around, instead of that dire messaging of COVID that we used to have to report on when, the pandemic was at its fullest. I'm yours truly, Dr. Pierre. I'm going to see you guys next week.